and welcome to another edition of Currently in Quincy. I'm Joe Catalano. On today's program, we will chat with Beth Israel Deaconess Medical Center Milton President and CEO. Rich Fernandez is here to tell us about their plans for an urgent care center in Quincy Center. First, though, as always, we check out the weather and the news for you this morning. Currently in Quincy, really nice out there, brilliant sunshine, 48 degrees. It's going to warm up nicely this afternoon into the low 50s. Great leaf raking weather today, but it's not going to last. Look at tonight. Temperatures will plummet again into the mid-20s. And not a bad weekend, certainly not as mild as today. Tomorrow with sun and clouds, brisk with highs in the mid-30s. More clouds on Sunday, a little warmer into the mid-40s, and some rain expected here on Monday, with highs Monday again into the mid-40s. But again, right now, sunny, 48 degrees in Quincy. In the news today, the Patriot House Sober Home over on Federal Avenue in West Quincy is suing the city and Ward 4 City Councilor Brian Palmucci, claiming that a city regulation that requires sober homes to register with the city is illegal. Palmucci co-sponsored that measure 2 years ago because he says sober homes are unregulated and could be dangerous for the residents that they're supposed to be helping. At-large City Councilor Nina Lang co-sponsored the ordinance and says it's worth the effort.
You know, the number of folks here in the city who have really banded together to get behind the effort to combat this problem. And, you know, particularly Laura Martin, I've gotten the pleasure of getting to know her over the years and to know the work that she's doing. Unfortunately, she has to do it because this problem is in front of us. But I think that this is an important stance for us to take and to continue to work together to combat this very serious issue. It's still very much in front of us. It's still very much in the forefront of a lot of people's minds, particularly here in this city. And I think it's important that we, again, you know, outwardly facing, take this step together to combat it. So thank you.
Lang is not named in that lawsuit. The suit claims that the ordinance violates federal anti-housing discrimination protections for people who are diagnosed with substance abuse disorder. Outgoing Quincy Ward 5 Councilor Kirsten Hughes could be the next clerk magistrate for the Stoughton District Court. Governor Baker recently nominated Hughes for the position. It now goes to the Governor's Council for review. Hughes did not seek re-election to the Ward 5 Council seat that she's held since 2012. She currently serves as General Counsel and Special Sheriff for the Norfolk County Sheriff's Office. Hughes was also past president of the state Republican Party and worked in the Quincy Law Office of Ward 4 Councilor Brian Palmucci. In a statement, Baker said Hughes' experience in both the public and private sectors will enable her to serve effectively in the Stoughton courts. Norfolk County Sheriff Jerry McDermott says that he supports a bill filed by State Representative Bruce Ayers of Quincy. It's aimed at protecting seniors from scams and fraud. McDermott testified at the State House recently in favor of the measure. It would create a fund to pay for educational programs designed to teach seniors and disabled residents the skills they need to avoid becoming victims of financial fraud, scams, and abuse. McDermott testified before the Joint Committee on Elder Affairs to voice his support for the legislation to address elder abuse and scams against our seniors. McDermott said much work must be done to safeguard against those who would do harm or take advantage of our elder population. That bill remains in committee. Norfolk County Register of Deeds Bill O'Donnell is about to kick off his 13th annual U.S. Marine Corps Reserve Toys for Tots drive. O'Donnell's office collects new toys every year to donate to the Marine Corps program, which was established back in 1947. Since that time, the 72-year-old program has collected 566 million gifts, including 18 million toys just last year. The program operates in 800 cities and towns in all 50 states and annually has 40,000 people involved in the drive, ranging from Marines to volunteers. Donations of new unwrapped toys may be dropped off at the Registry of Deeds on High Street in Dedham Square from November 18th through December 11th. Well, the Quincy Police Department recently donated almost $12,000 to the cancer awareness organization called Marissa's Mission. Officers raised those funds through the sale of their Pink Patches program. Pink Patches is a collaborative effort between law enforcement and public safety agencies to bring attention to cancer patients and treatments. Marissa's mission was founded in memory of Marissa Federico, who died of breast cancer 3 years ago at the age of 38. She was National Sales Director at the Boston Convention Marketing Center. Now that you are up to date with weather and news, let's check out our programming lineup for later on today here on Quincy Access Television. Starts with a replay of this program currently in Quincy at 5 o'clock. After that at 6, Sound Advice with attorney Tom Williams.
Hello, folks. I am attorney Tom Williams, and welcome to Sound Advice.
6:30, the Schiller Boston Community Chorus and the Jenna Jubilee Singers Walk Together Children. Democracy Now!, a special 2019 Presidential Forum on Environmental Justice at 8 o'clock. And then at 11 o'clock tonight on Channel 8, Democracy Now! Check out Channel 9 every day. Learn about Quincy City Departments, different committee activities. All starts at 5:30 with Quincy in Focus. Update DPW at 6 p.m. All about the fall season. 6:30, it's FYI from the Quincy Health Department. Topic tonight, sleep disorders. This week's Quincy Board of License Commissioners meeting at 7 o'clock on Channel 9. Then at 8 o'clock, the recent Southwest Middle School dedication ceremony. Good Deeds at 8:45, their building rededication ceremony. And at 9 o'clock, find out what's happening at your library for the rest of November.
Welcome to At Your Library.
Get a complete program schedule on our website, which is qatv.org. Just click on Program Schedule. And do please like us on Facebook and follow us on Twitter. Don't forget, too, our weekly ad in the Quincy Sun. Coming up, we take a check of some of the current events and activities that are featured on our electronic bulletin board on Channel 8 for your information. Please stay with us. We're back with you in just 1 minute. Welcome back. Here is a check of some of the current events and activities that we're showing on our electronic bulletin board on Channel 8 for your information. Don't forget, Quincy Farmers Market will be open today and next Friday up at Pageant Field from 11:30 to 5. Then a Winter's Farmers Market will be held at the South Shore YMCA on Fridays from 11:30 to 3. Right through February the 14th. Go to quincyfarmersmarket.com for all the details. City of Quincy will be hosting Fair Saturday events on November 30th, marking the international event to celebrate the arts and culture. City of Quincy, the first North American city to host Fair Saturday events that are free and open to all. Visit fairsaturday.org for more information. North Quincy High Class of 2009 10th reunion will be coming up November 27th from 6 to 10 at the Fours Restaurant, Quincy Center. You can go to nqhs2009reunion@gmail.com. No tickets will be sold at the door. And a free legal clinic is coming up December 3rd from 6 to 8 over at the Quincy District Courthouse. You can call them 617-471-9693. Visit the website for the Bar Association of Norfolk County for all the details. And if you have an event or an activity you would like to promote, just visit our website, qatv.org. Download a bulletin board request form, fill it out and send it in. We'll put your message up here on Channel 8 too. Coming up, we sit down and chat with Rich Fernandez of Beth Israel Deaconess Hospital, Milton, next. Welcome back. The folks from Beth Israel Deaconess Hospital Milton have been here in the city of Quincy on several occasions recently. Most importantly, to talk about a new urgent care center that'll be coming to Quincy Center in the not too distant future. So President CEO Rich Fernandez has come on back to the program here once again to tell us all about that. Rich, good to see you again.
Nice to see you too, Joe.
Yeah.
Thanks for having me.
Pleasure. Welcome back.
Yes.
Seems to be kind of a regular trip over from Milton to Quincy these days for you.
You got it. Quincy's a big part of the patient population that we serve, so really thrilled to be here to tell you about our next new venture here in the city.
That's just great. Yeah, it was the old career center years ago over on the Parking Way.
Yep.
Now is being transformed, I guess, into a whole new medical complex.
You got it. We are really thrilled. In the spring, we aim to open on the first floor there of the Parkway a urgent care, which we staff 10 hours a day initially, and ideally 12 hours once volume grows, but with emergency medicine physicians, which means they're the same physicians that you see in our emergency department. We'll be staffed there. We'll have x-ray and lab, so we really hope you'll take care of a more complex than just the traditional urgent care, but we'll take care of all patients, any issue, and obviously if there's something that is truly an emergency, we will kind of get them there quickly to our emergency department.
Sure.
So we're thrilled. But in addition to urgent care, we also know that most healthcare needs start with good primary care. So we have space there. About a third of the space is for a dedicated primary care site. We'll have 2 primary care physicians there with open panels when the practice opens, and then also we'll have a subset of specialists that will be available. Things like orthopedics, general surgery, podiatry, and ideally pulmonary and cardiology and others over time. So we're really excited to really be able to offer this. We've served the city of Quincy for a number of years, so let's make it a little bit easier for patients for those services not to have to come to our office or emergency department.
The actual name will be Beth Israel Lahey Health Urgent Care. Yeah.
Yes, I mean that speaks to our new partnership with Beth Israel Lahey that started in March of this year.
Right.
And it's really one of the first initiatives under that BILH umbrella to do it, and we're really thrilled. We'll have big prominent signage, and we really hope that this will serve the city of Quincy and the population here and the people.
What was kind of the thought process, Rich, when considering this move and opening this center? Why is it so important?
I mean, from real practical purposes, we know that people use emergency departments, Milton's and others, oftentimes for things that aren't quite at that level, but that's really after hours and on weekends. That's really sometimes the only option. So from a cost, we know people are looking closely at healthcare costs. We wanted to be able to provide high quality, lower cost option for a high level of both urgent care, primary care, and specialty care. And this site will do that in spades in all those areas.
Okay, so is this a 24/7 operation?
So the urgent care will be up to 12 hours
Okay.
is generally what we'll run, but it will be 7 days a week.
Okay.
And again, we hope to really partner with primary care practices, employers, and others to make sure they know that we're there and that we'll take great care of their patients and hopefully get them back to their home or back to work quickly.
So is this a place too where, say, ambulances would be coming to bring patients to?
Technically, the way the ambulance regs are written, right, you can't technically bring someone from an ambulance.
Okay.
They typically have to go to the emergency department,
Okay.
but we would like to work with the state and others to, for a non-true emergency, we'd love that to be an opportunity.
Okay, so this, really is a significant healthcare offering that the city hasn't had really since it had a full-blown hospital.
You got it.
Yeah.
Right. I mean, emergency physicians, they can do the stitches, they can manage airways, and again, they are the same docs that you see at our emergency department.
Yeah.
So we really believe this will be a higher level of care and complexity.
And you mentioned surgery. I don't even think that's done right now at the emergency department.
Yep. So the docs will not be doing surgery in the office.
Oh, okay.
They will see you in the outpatient and then as a consult
Gotcha.
and then have surgery done there. Although the orthopedic, oftentimes orthopedics and podiatry, there are procedures, not surgery,
Yep. Okay.
that we can do in the office.
Okay, yeah, non-invasive arthroscopic type
Yep.
procedures, yeah.
Yeah, and so the orthopedics, just to add a point of clarity, we will have a general surgeon. We're actually bringing in a non-operative orthopedic
Okay.
provider because what we've heard from patients and primary care physicians and others that easy, quick access for the weekend warrior
Yeah.
who hurts their knee or the child that might have an issue.
Yeah.
This will provide great access if they require surgery,
Yeah.
which hopefully through PT and other areas they don't.
Of
But if
course,
they
yeah.
do, obviously we'll get them to one of our orthopedic surgeons. But
Okay.
we intend to bring in a full-time orthopedic surgeon in the 6 months or so after opening. But our hope is that we have great access
Yeah.
for orthopedic and some of these other specialties, which right now in the city there's probably limited
Yeah.
access. So.
And I would think too that the quicker the care is provided, the less injury could result. And,
Yep.
and
Some people, because access or transportation is an issue,
Yeah.
they don't really get it addressed. And
Yeah.
sometimes particularly when you're dealing with bones or the human body, time does make a factor.
Of course,
So we
yeah.
hope to be there for the patients and people here in the city.
Are you doing this in any other communities?
So it's interesting. So the Beth Israel Deaconess Medical Center has a similar model in Chestnut Hill.
Oh.
There's also one in Chelsea, and this one is similar to the one in Chestnut Hill, where it's really embedded both urgent care, primary care, and specialty.
Oh, I see.
We want to make it as much as we can kind of one-stop shopping. And,
Okay, yeah.
The good news about this space is that we're building out about 3/4 of the space.
Yeah, we have a rendering I want to show folks actually.
Oh,
so,
that would be
yeah,
great.
they can see what you're
So
talking about.
we hope that it's wildly successful,
Yep.
and we can add the next level of whether it's specialty services or additional ancillary support, imaging, or others. So.
Okay, so folks are
Oh
taking
yeah,
a
there
look
you
at
can
it
see
right
the
now.
site.
Yeah.
So when you look at the rendering there, we have the entire first floor.
Okay.
And again, if you think of it as kind of thirds, a third will be urgent care, a third specialty, and a third primary care. You can see the parking spots out front there. Those are technically city spots, but we hope to work with the city that, whether it's for ambulances that are bringing non-emergent patients there or patients that need close proximity, we hope to work with them in the front side there.
Okay.
And then what we found really unique to this space when we looked at a lot of different real estate in Quincy is that there's actually some dedicated parking. Some is absolutely dedicated right behind the building, and then we have access just to the left there on the Party City side to, I think it's close to over 40 spots. So for both employees and employee, but mainly for patients,
Right.
They'll have parking. And I think most of the residents here in the city also know there's parking directly across the street, but ideally
Right.
we'd get them as close as possible to
Sure.
the building.
Yeah, and parking is taking a priority now with the downtown
Everywhere.
redevelopments.
I
Yeah, for sure. There's a new garage just set to open actually later this month
great.
at the old Hancock parking lot, a
Yep.
public parking garage. The proposal at the old Ross Parking Way right across the street
Yep.
also includes a public garage, and
Yep.
hopefully the MBTA
Good.
station at some point will have a new parking garage as
Oh,
well.
great.
Yeah, so there's definitely
High in people's mind.
thought behind that for
Yes.
sure. Yeah. Now, who will be able to use this center, Rich?
This is open. I mean, part of the Beth Israel Leahy mission is treating any and all who come.
Okay.
Whether there's language differences. Our
Yep.
first provider actually speaks Cantonese. We hope to staff it with multilingual staff. So we take all comers.
Okay.
Whether you're associated with a health center, with an Atria, it's a different primary care group. We hope to be able to provide great care, communication and coordination back to the primary care or other specialists who sends them there.
Okay. Staff-wise, is it ready to go? You've got folks
We're
lined up?
working through that.
Okay.
We've hired our manager. Again, like I said, most of the providers that will be there, we've already hired.
Yep.
My sense is probably in January, we'll start the hiring process of the various medical assistants, front desk staff. But we're excited to have that and really look forward to hopefully finding people who know in the city of Quincy who want to be part of this new exciting venture here.
Yeah, and the primary care docs will be accepting patients?
Oh, absolutely.
Okay.
Yep. In fact, at least the one we have started, we actually started in another clinic, but they'll have plenty of capacity. That's our goal, is to really bring in new providers
Yeah.
that have a tremendous amount of access.
Okay. How about pediatrics? Any services?
Yep. So we won't. So one of the doctors we hired is a family medicine physician,
Okay.
so they would be able to take care of children. We at the hospital don't take care of pediatrics, so we would work with one of the children's, either downtown Boston
Yep.
or MGH, wherever
Okay.
they traditionally get their care.
Okay.
But we will be able to serve in their urgent care and the primary care, any age group.
Sure. What is the attraction of Quincy, Rich? I mean, yeah.
I mean, we've had a long-standing commitment.
Yeah.
In fact, most of the patients that are hospitalized at Milton Hospital are actually from the city of Quincy.
Really?
And that's been true. Obviously, it picked up a bit when the hospital closed.
Of course,
but
yeah.
we've always supported this and had a lot of patients from this community. So we were looking at, I think the mayor said it's close to 100,000 or over next time they take the
sure.
census.
Yeah.
So it's a big center. It's a place we've always served, and we know the city is craving for clinical services.
You're well aware, of course,
Sorry about
that no, it happens all the time. That South Shore Health is also planning a large complex right
Yep.
across the street.
Yep.
Is there market for both?
Oh, I believe so.
Really?
I think a lot of people in the city, if there's an option in the city, are going to choose to perhaps maybe change their primary care. I also know by all the construction,
Yeah.
there's going to be a lot of people moving into this
True,
city. So we
yeah.
want to make sure they have a great, high-quality, easy access option.
Okay.
So I think it's great. I mean, competition's competition, but
Yeah.
you know what? In terms of our overall mission and of serving the populations that we serve, this is what we want to do. So I would say the more primary care in this region and in the state is better.
Yeah. Well, it's like you say, new people are coming in all the time. There's a new apartment complex going up right across the way.
Right.
There'll be hopefully another new one downtown very soon. So
Yeah.
you almost have a built-in market
Right there.
right downtown. Yeah.
Yeah, I mean, you don't need to go to Boston for health care, right? You can stay right in the city and have great access, and our hope is to be able to really, over time, fine-tune that need. I met with some community leaders the other day, and they suggested, should we be looking at pulmonary and cardiology as other services? It would be really helpful. Instead of driving downtown for a cardiology visit, we can have some of our Milton or Beth Israel Deaconess, Harvard faculty
Yeah.
come to the site too. So we're excited, and we really want to partner with everyone in the city for this.
The one thing, and I'm sure you've heard this too, that folks miss from the old Quincy Hospital is maternity. And it doesn't sound like there's going to be a plan for that in this particular
That I wish I could
Yeah.
tell you something different, but that is not
Yeah.
in the cards right now.
Right.
But there's the good news is you're in Boston. There's great opportunities at the medical center and many other
sure.
facilities for that.
Yeah,
But that will not be part of the cards.
Right, yeah.
wanna
I'm
be
sure you
straight.
hear it all the time too, though. I was born at Quincy City Hospital,
Yep.
and
But there is a great option at Milton Hospital. We have a full-service women's health program
Okay.
staffed by OBGYN physicians from the medical center. We, in fact, take care of over 200 women in our medical office building who get all the prenatal care at Milton, deliver their babies downtown, and then come back to Milton Hospital for their postnatal care. So if you like convenience and you want a great OBGYN, we have OBGYNs right at the hospital in our medical office
yeah, it
building.
really is kind of the new healthcare model, isn't it? Is suburban care, is
Yep.
community health rather than big urban centers.
Yep.
Yeah.
And if you look at it, most of the community hospitals, including Milton and our sister hospital, that's part of the beauty of that affiliation. There was actually an article, I think, about a year and a half ago now in the Globe in the summer that said, how do you access world-class care? And the second area was you can access it right in your community
Yeah.
because most community hospitals are partnered with big academic places. So quality's the same, access is better,
Right.
and it's right there locally.
Yeah.
So.
I mentioned you've been in the city frequently over the past several months. One reason was to make a donation to the Quincy Community Action Program's homelessness prevention program.
Yes.
Why was that?
So if you look, if you've read about healthcare today, in addition to life-changing surgery and cancer treatment, the reality is what we're all learning is the social determinants of health. Things like food, good housing, education actually have a huge influence on people's ability to both access care and stay healthy.
Yeah.
We're committed to continuing to work with all of our communities to address those needs, and QCAP is just an unbelievable resource in this city, in this region. Great leadership. Great mission, and we really felt like we wanted to partner with someone who could help make a difference. So this $45,000 grant that we're doing is really going to help people who are having housing challenges, whether they're school age or elderly, to help them have stable housing. We know how big of an impact that has on health and access to health and other ramifications.
Sure.
So we're proud to partner with them, and we really think it'll make a difference to keep people here in Quincy in their homes or apartments or wherever they live to be more stable.
That's great. Anything else, Rich, we should add?
No, we're thrilled. We can't, hopefully there won't be too bad of a winter, and we'll get this site opened up in early spring, probably likely in May.
Okay.
And we really look forward to the community's input and hiring great staff and making this a real asset to the city.
There'll be a big Susan ribbon cutting, open
Oh,
house
yes.
type ceremony, maybe some cake.
Yes, plenty of that.
Okay.
Maybe some fruit.
There you
Fruit,
go.
a fruit,
Healthy stuff,
option.
of course,
Yeah, yeah,
yes. Beth Israel Deaconess Milton.org, I guess, or BIDMilton.org is a
Yep.
good place to go to get some
You
more
got it.
information.
Yep,
Great to
so-
see you again, Rich.
Yes, thanks for having me, Joe.
You're welcome, pleasure.
All right.
Just enough time to recap the forecast for you for the rest of the day. Today, just gorgeous. Lots of sunshine, mild temperatures in the low to mid 50s this afternoon. A little breezy too, but the bottom falls out again tonight. So don't put the winter weather gear away just yet. We're looking at mid 20s this evening. Tomorrow, pretty chilly, some sunshine, but only in the mid 30s. A little warmer on Sunday with clouds in the mid 40s. Next chance for rain around here. Just perfect for a Monday. Thanks again going out to Rich Fernandez for joining us from BID Milton. Thank you, Rich.
Appreciate it.
You're welcome. Thanks to our crew, and thank you for watching. Monday at 11:30, Quincy College Athletic Director Jack Raymer's here on another edition of Currently in Quincy. We will see you then.